To the medical expert. Anne Rimoin is a professor of epidemiology at UCLA and the director for UCLA's Center for Global and Immigrant Health. So, Dr. Rimoin, thank you so much for being on with me. I got a bunch of questions for you. Just starting with, we played some of the sound from the president off the top when he was speaking this morning, and he is giving more power to the states in terms of testing, for example. Do you think that will be effective? Will that work?
Well, I think it's a very good idea to give states more powers. There's no one-size-fits-all solution for outbreaks or for epidemics, and certainly not in a pandemic scenario. You know, we learned this. I've spent many, many years working on Ebola, and what we've learned there is that you can have general regulations, but what you really need is to tailor solutions for each population. You know, California is very different from Alaska, which is very different from Mississippi and from Wisconsin. So it's going to depend upon the density of people, how people are generally interacting, where the hospitals are, how people can get care. I mean, all of these things need to be taken into account when thinking about how to manage an epidemic of this scale.
Sure. And in terms of people getting care, President Trump also mentioned today, basically gave the green light to the Army Corps to build more hospital beds as health officials sound the alarm on the stockpile shortages. You tell me, what medical supplies are needed the most right now?
I think there's a whole host of medical supplies that are needed right now. I mean, we know we need more ventilators. We know we need more of the supplies that go all around ventilation and managing care for people who have respiratory problems. But the biggest thing that we need to think about right now is the personal protective equipment, what we call PPE. And this is something that is going to protect our healthcare workers. And I think that the big issue that we have not been able to solve as of yet, is how healthcare workers are going to have enough PPE. We know that hospitals are running out, and that this is the rate limiter. We have to protect our healthcare workers. They are our most precious resource in this issue, and they're on the front lines and exposed without what they need to protect themselves.
To that point, we have heard about 200 nurses at one facility being exposed. 9 doctors down at Emory in Atlanta have gotten sick. If this continues, the question I'm getting from a lot of people is, how do we make sure we have enough doctors and nurses just to fight this, let alone people are still breaking arms, having heart attacks, etc.?
Well, you're not going to be able to fabricate new nurses and doctors in a matter of days, unfortunately. So what you need to do is you need to be able to protect these healthcare workers. I know I'm repeating myself, but it goes back to the same thing. You have to provide them with the tools that they need to protect themselves, and that is personal protective equipment. They have to have the masks, they have to have the gowns, they need to have the goggles, they need to have gloves.
But if they're in short supply, how are they going to get them?
It's a very good question. I think that the government really needs to think about this and to take drastic action to ensure that they have these things. You know, the general public doesn't have it either. I mean, hand sanitizer, gloves, you know, all of these masks, all the equipment that I've just mentioned. There has to be a way. They're going to have to find ways to be able to provide these materials, whether it's working with industry or finding other solutions. I mean, I don't, that part luckily is not my job, but I can tell you that's what we need.
Yep. I hope the government's listening. I know they are. Also, and I'm going to set you up for a question that you really may not know the answer to, and that's okay. But, you know, everyone sitting here is like, all right, how much longer are we going to have to endure this, right? So President Trump said today he wants people hunkering down for 2 weeks. I was listening to Governor Cuomo here in New York this morning saying it'll be 45 days before just the state of New York alone sees its peak. Realistically, how long do you think we are going to be living in this hunkered down reality?
Well, I wish I could give you an answer that would make everybody feel better. But the truth of the matter is we don't know. What we can do is we can look to other countries. There are other countries that are ahead of us in this epidemic curve. So we can look to Italy, we can look to South Korea, we can look to Singapore, we can look to China, and we can also look to see how these countries managed these outbreaks and understand what's happened as a result. How long we are in this situation is directly linked to how well we manage it, how well people are are following social distancing. And I think that that is a very big issue. People have to social distance. They have to respect that. And we have to be able to empower our healthcare workers. I think that these are the key things that we have to be able to do. We have to be able to flatten the curve, and that takes everybody working together to do it. And if those things are in place, then it's very possible that we'll be able to get out of this situation much sooner.
Hopefully so. Hopefully so. Hope everyone's just hanging, including me, hanging on your words about social distancing, staying home, doing your part so we can roll through this together. Anne Rimoin, thank you very much.
My pleasure.